Hi, my name is Desiree. Nice to meet you. I'm going to wash my hands. I'm going to do a peripheral vascular assessment on you. Basically, it just means I'm checking your circulation. Can you verify your name and date of birth for me?
John Booth.
All right, Mr. Booth. I've already obtained a past medical history and a surgical history. I have found out that he's a smoker. I have also obtained a full set of vitals, including a blood pressure. The patient is undressed. I just have a drape basically over the genitalia area for privacy. Okay, first I'm just going to look at his general appearance to make sure he's not in any type of distress. Next, Mr. Booth, can you put out your arms for me? First I'm just looking to make sure that there's symmetry there, there's no abnormal venous patterns, the hair pattern is normal, no scars, no edema. Next, I'm just going to feel temperature with the back of my hands. Make sure everything is the same temperature. Okay. After that, I'm assessing capillary refill. Okay, it's less than 2 seconds. Good. I'm also looking at the nail beds to make sure that they're not blue or discolored or anything. I'm doing that on this side as well. Okay. All right. Next, I'm going to be assessing pulses. Doing the radial pulse, okay, 2+, good. And then I'm doing the ulnar pulses, okay, good. Brachial, okay, on this side as well, good. Then I'm looking at the epitropial nodes. Any tenderness?
No.
Okay. On this side as well. Tenderness?
No.
Okay. I'm also feeling for any tenderness under the axillary. Any tenderness?
No.
Okay. Here as well?
No.
Okay. All right. Next, I have to test the patency of the radial nerve. If you could put your hand in a fist for me. Perfect. Okay. So I'm going to ask you in just a second just to open your hand for me. All right. Open your hand for me. Okay. I'm looking for basically capillary return. Make sure that it turns pink again. We're going to do it for the radial nerve now. If you can close it. Okay, 1, 2, 3, 4, 5. Go ahead, open. Okay, good. All right. Do the same on this side. Go ahead and open for me. Okay, and again. Open. Okay, good. All right. Now, if I can get you to lie down for me. We've got genitalia covered. Privacy. All right. Next, I'm looking at his legs just to make sure there's no there's symmetry, that there's no abnormal venous patterns. Looking for any scars. I'm looking for any abnormal hair patterns. I'm going to check pedal pulses next. Okay, 2+, good. I'm also going to check posterior tibial pulses. Good. I'm going to look at cap refill on both. Okay. Also checking temperature with the back of my hand as well. Okay, I'm going to look for any edema. I'm going to press for 5 seconds. None. Okay, I'm going to press for 5 seconds. None. And I'm going to press here. Okay, so no pitting edema, non-pitting edema. Next, I'm going to check for popliteal pulses. Okay, thank you. And here. Okay, and next I am, any pain in the calf?
No.
No warmth. Okay. After that, okay, now I'm going to be assessing your femoral pulse. Okay. On this side over here as well. Okay. Now inguinal nodes, any tenderness?
No.
Okay. I'm also going to listen, make sure there's no bruise over the femoral pulse. Okay. All right. Next, if the pain had complained of any pain, I'm just going to test for any arterial insufficiency. I'm going to ask you to raise your legs for me. Have the patient keep it for about 60 seconds. Okay, I'm just looking after the 60 seconds to make sure there's no abnormal pallor. Some is normal. Okay. Now if I can get you just to go ahead and place your feet to the floor for me. After about 15 seconds, I'm just making sure that the veins fill back up, that there's no dusky color to the feet at all. Can you stand up for me? Okay. Now I'm just checking for any varicosities, any pain, any ulcers, anything. I also check between the toes there. And I don't see anything. Any concerns? Any complaints? Any worries? Okay, any questions?
No.
All right, thank you very much. Bye.